Good evening. My name is Margaret Jennings. I'm a microbiologist who also assists general practice with infection prevention control. Today is the 20th of August 2021, and the situation right now is desperate times, call for desperate measures. And so I want to give a quick 8-minute on donning and doffing full PPE when you're in a situation where there is potential for positive cases. So that would be testing and obviously seeing symptomatic patients, and conducting processes inside where there's a chance for positive. So the first thing we do is hand hygiene. Needs to be done correctly. Get into your nails, cover your skin, and then rub it in. It can't be wet, it can't dry before 15-20 seconds. That's how long it takes to actually affect the envelope on this virus, and we actually want to damage that so it doesn't stick to your throat. The first item that we put on is your gown. This is a long sleeve gown. It ties up, obviously, and I probably won't do a very good job of it now because I'm in a screaming hurry. But what I did want to show, I'll put this a little bit further down, is that when you do the back, you see how I've covered my clothing completely. So now I tie the back, probably do the same bad job of that. Then I'm going to put my mask on, and I'm going to be using a P2 N95 mask. Some of you might see it as a K N95 mask. It's got a nose bridge. It's very thick, as you can see. And the point is I want to be able to take in my air completely through that mask. Now, all I can show you today is a fit check, which you will do every time you use one of these masks, every time. Gold standard is to, on top of that, have a one-off fit test, which is done on the type of mask that you use to ensure that you can get a good seal. But at this point, we probably don't have access to that. So I need to know that you can use these safely and effectively. We don't actually know the difference that it makes to having a fit test done, but it is considered gold standard. So I put my head or my mouth in there. If you had hair like mine, you might wear a cap. So one goes on my crown, the other goes under my ear. I come round to the front, and about 1/3 of the way down my nose, I pinch. Make sure there's no hair there. As I said, if you've got long hair or fluffy hair like mine, wear a cap. Now, to make it a decent check, I can pinch this and yawn a bit, and pinch a bit more. Now I'm going to do some heavy breathing, and you should see the mask collapse, or the respirator, it's correctly called. Good. There's no hot air leaking out, and there's no cool air coming in. That's what you want. The next thing to put on is your face shield. Okay, we only ever touch the back of this when we're removing it, and we can just pop it into a plastic bag, a large plastic bag, that can be washed. This is if you've got this stuff on for a couple of hours while you're testing, etc. So that's the situation that we're looking at. I now put my gloves on, and your gloves are the one thing that you will change between patients. The only time you would really need to change the rest over, say, a 2-hour period is if you are coughed on or something like that, or become contaminated. Now, did you see that I put the gloves well over the cuff? This is because of the way we remove them, and we need to ensure that we don't have any skin. Okay, so a good inch over there. So now I'm ready to go to my patient. If you do wear a cap, it's not for infection prevention control reasons, it's just to keep your hair out of the way. So don't sort of get tangled up with that. Make sure you've got good protection around here. So once I've worked with my patient, I stand back. And if I'm just changing my gloves because I'm going patient to patient, that's called extending the use of the rest of my PPE. But let's say I'm actually now going to take everything off. So I grasp the glove, and then I lift the other one over it, into the bin, into the clinical waste bin, back to the alcohol, always. And I'm sorry I'm picking back my gown there, naughty, naughty. Always do your hands after you've removed your gloves, because gloves are not a perfect barrier. Plus, I may have inadvertently touched a part of my gown. The next item to take off, and if you have a look at the national guidelines, this is in line with that. I undo the back, undo the top. Now, what I do is not touch the front outside. Remove the gown, and that it also then gets dropped into a clinical waste bag. Now, if you have a look at the guidelines, it's hand rub again. I'm going to probably forgive you if you forget that step, but it's critical to do your hands after the gloves and certainly at the end. So let's say, yes, I've done my hands again. To remove this into a bag, if I was just removing it for a lunch break and I wasn't seeing high risk patients, I could, yes, wipe one side with one detergent or disinfectant wipe and the other side with another and hang up to dry. But at the end of the day, it gets washed. But when you're seeing high risk throughput, you would be disposing of that after you've done your 2 hours, of seeing them. And I say 2 hours because it's difficult to wear these for any longer, and lots of reasons why. So to remove this, which is the last item, I grasp the 2 ribbons and it's away and down. That's the way you remove it. And then hand hygiene once more. Hopefully that's helped you get the order right. So it's always, mask on. Mask is off last. It's the most protective thing. It's always gloves on last because it's much easier to get them on once you've got everything else on, and it's gloves off first. It's mask off last because it's the one thing that gives you the most protection out of all those things. We haven't got strong evidence that transmission is coming off the gowns, but we have got evidence now that a P2 mask is more protective than a surgical, but we tend to keep the P2s for when it is absolutely a risk situation. So hopefully that has assisted. And don't forget, one little tip, pressure on the nose. You'll see people ending up with problems, a bit of hand cream on there. And that's another reason for changing every couple of hours, just to get the pressure off that. If you're wearing, if you want to wear goggles, that's okay, but honestly, most people have moved on to face shields, but also it's pretty hard. You're putting now more pressure with the goggles. And also if you're wearing glasses, you can imagine the situation you're in. It's much easier to have your glasses and your mask and then your face shield, prescription glasses. Okay, thank you and best of luck.